I'm Isaiah Kyle.
I'm Tristan Love.
The American Medical Association reported last December that drug abuse and the overdose epidemic has gotten worse. More than 107,000 deaths were reported in the U.S. between January 2021 and January 2022.
Illegally produced fentanyl, as well as methamphetamine and cocaine, are the culprits. How does it look specifically in Connecticut? Doctors, law enforcement officers, and one firefighter offer their perspective.
How many drug overdoses would you say you have a week?
Actually varies quite a lot, and it's often related to what's out on the street. Some weeks we may not see anybody, or just one or two, and then a month or two ago we had a day when we had 3 or 4, and in fact that day we actually had like 2 people die out in the community before they got brought in.
But lately it's been kind of sporadic. So, one week we may have a whole string of overdoses, especially with this fentanyl epidemic that's been going on. And then there may be like a dry period where we don't see it. But I would say on average, a week we're seeing at least 5 overdoses.
Can you explain to us what fentanyl is?
Sure. So fentanyl is a version of a narcotic. It's called all of these narcotics we're talking about are opioids. The thing about fentanyl is on a per milligram basis, or it is much, much stronger than opium or heroin.
So how have you seen things get worse throughout your career as a doctor or physician?
It's everywhere, but I have seen over the last year or so, especially the last year, that there has been definitely an uptick or an increase in overdoses, especially from fentanyl, which is pretty devastating.
Have you ever administered Narcan to patients?
Yes, I have. Narcan is a drug that we use to administer to combat an opioid. If the patient is on some type of drug, we'll assess them. Usually the pinpoint signs are pinpoint pupils, excessive sweating, their heart rate is extremely elevated, and it's called agonal breathing. It's like they're struggling to breathe, but they're still breathing. Once you have those telltale signs, we'll determine whether the patient is Narcan or not. It's always going to be a yes. We're going to Narcan them. The city of Bridgeport uses a dose of 4 milligrams per capsule. So we inject it into one nostril. We let it flow in. Then we start giving them ventilations, and usually it gets them out of them within a few minutes.
Born and raised here in Bridgeport. I lived here my entire life. So I feel like I can connect more to this community here that we have in Bridgeport. I see it every single day. But it's unfortunate that you see them every single day and you see them out in the corner hustling, and having to see that it's something that you're not going to forget. I don't think that there isn't any person, any parent, any adult that doesn't wish that whether their kids or their loved ones consume fentanyl, whether it's, on purpose, accidentally, or it's a drug of choice. I've recently heard of a case that a child consumed fentanyl.
We're averaging right now, probably on a weekly basis, we get about 5 to 6 narcotic case arrests, and we're seizing on average 2 guns a week. With drugs comes the gun violence, so they kind of go hand in hand. Our best case is probably 2 kilos of cocaine and about 10 pounds of marijuana. Every 2 to 3 cases involves a teen. So if we do 5 cases a week, you're talking 2 or 3 of those cases involve a teen. So 150 times a year.
Our friends, people I trust, like people I'm with right now, I trust them with my life, of course. But I don't know what they consume and what they're trying to make me consume. Somebody may give me a bottle of juice, and I don't know if it's laced with codeine. I don't know if it's laced with any of that. It could be lean, of course. It could possibly be lean. And I don't know if it's laced with any of that stuff. And people are doing drugs every day, in the morning, noon, every day people are doing that. And I do get asked or, peer pressure to do it, but I don't do that because I'm trying to stay focused on my career and the life I want to live.